Doing very well here, Neil. And you?
Very good. Next topic I never thought I'd talk about either on a podcast. Gonorrhea. All right. What is the common name for gonorrhea?
Well, it's most often referred to as the clap or sometimes the drip, depending on where you are and how old you are.
What causes gonorrhea infection?
It's called Neisseria gonorrhea. It's an obligate fastidious. That means it doesn't do well with a lot of oxygen, and it's a diplococcus, meaning that it's two round circles put together. Anyway, it's called Neisseria gonorrhea, and it's been around for a while too.
Is gonorrhea an STD?
Yes, it certainly is. It can infect genitals, rectum, and throat. And um, it's very contagious.
Is gonorrhea common?
Well, unfortunately, yes. In the common, it's the so-called second most popular STD globally. So it is very common. The only thing that is more common, they say, is chlamydia, although I do think that probably ureaplasma and mycoplasma are more common. They're just not recognized as STDs.
How does gonorrhea spread?
Well, it's sexual contact, including vaginal, anal, and oral sex, and it can be spread from moms to babies during childbirth
What
and
are
by
yeah.
sharing sex toys.
What
Sorry.
are the symptoms of gonorrhea?
Well, some men and some women have no symptoms. Men are probably a little more likely to have symptoms than women, but symptoms would include burning with urination, discharge, testicular pain if you're male. Women would have maybe some discharge between their periods, painful urination, um, and sore throat.
What are the complications of gonorrhea if left untreated?
Well, they could be infertility, abdominal pain, scarring, even for women winding up with a hysterectomy. Uh, Untreated gonorrhea in men can cause epididymitis, which is an infection in a tube that goes from the testicles to the prostate. Infertility, prostatitis, you can get a prostate, even an abscess. And it can spread to skin, blood, joints, and can be life-threatening.
What is recommendation, diagnosis, and treatment for gonorrhea?
This is also blood tests, urine tests, or swab samples.
What is the usual treatment for uncomplicated gonorrhea?
Well, this is actually very simple. For the most part, and this is what I would recommend, istrocephan, 1 gram, one shot, one time. Get retested. That's really important. And avoid having sex with somebody who has gonorrhea until forever, I guess, but certainly avoid sex for about a week. Get tested again. Sexual partners should be tested. Um, yeah.
How do you prevent infection with gonorrhea?
Well, have sex with one partner, use condoms, and get tested.
How common is gonorrhea?
Well, like I said, it is only slightly less common than chlamydia, but it comes in number two in the world for sexually transmitted illness.
If someone's pregnant and gets gonorrhea, what happens to the baby?
Well, traditionally, we have thought again that the baby gets gonorrhea by going through the vagina, but I think that it actually can ascend, in other words, go up to the fluid around the baby and infect the baby. In the past, we have done, and this is actually a law for many years, we have placed silver nitrate in the eyes of the babies. And this is years ago, you could see the silver nitrate because it looked like the babies had eye makeup on, get black around the eyes. Today, we have decided to use what's called an erythromycin ribbon just around the eyes. Erythromycin is an antibiotic, and it is actually more humane than silver nitrate. I can guarantee you, you would not want to have silver nitrate in your eye. It would burn a lot.
All right. The best place to go is world.allen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right. That